All right, so it is 3 p.m. on the dot my time, so I'm going to get started. To introduce myself, my name is Allie. I am a doctor of physical therapy as well as a nationally certified Pilates instructor. I've been teaching in Boston for the last 5 years. I opened my own practice a few months ago, and I've had the wonderful opportunity to teach with the Community Online Academy for the last 12 weeks. So today's program for our 5-star members is a program on lower back pain, specifically how to manage lower back pain with a foam roller. So it's going to be 30 minutes, mostly movement-based. We'll do some stretching and some strengthening using the roller, and then I'll save just a few minutes at the end to go over any Q&A that you guys have. So with that being said, I want to make sure that I highlight that this class is designed for you to get the most out of this experience. And if something doesn't feel quite right for your body or your back, please take a modification or take a little rest. The point of this class is for you to feel good, and because everyone's backs are different things might need to be modified or changed from person to person. So I just say don't hesitate to change things if you feel like you need that. So with that being said, we're going to get started on the mat, lying down on our backs. And I'm going to show you guys a couple little tricks for getting set up using our foam rollers. So I will bring my roller perpendicular across the mat. And then I'm going to put my feet on the other side of the roller on the floor and then lie down onto my back. And I see a few people who are just logging in and getting started. We're just grabbing our foam rollers for our program. So the way we're going to start our class today is placing the foam roller underneath our sacrum. And for those of you who are not sure what your sacrum is, it's the bony part of your pelvis right beneath your lower back. So when we lift our hips up, I don't want you to place the roller on your low back. I want it to be on your sacrum, so that bone right below your spine. So we're going to lift our hips up and pull the roller underneath your sacrum. And so when you place it down, it should feel relatively comfortable. It should make it feel like your back is being supported. And sometimes this is a big lift, and so it can take a moment or two for our backs to settle in. But when you get that set up in that sweet spot where it feels like a strong support for your back should be able to relax a little bit. So we're starting class this way because this is a nice place to decompress our spine. So I'm sure for those of you who have had back pain from time to time, it has felt like your spine is being compressed. And so by using gravity, by getting our hips up a little bit higher than our shoulders, we're able to decompress our spine by just laying in this position. So this is something I like to show people. You can use it almost like a little Tylenol for your back. If your back is bothering you, just setting up in this position and laying here for a couple minutes can be a great place to start. So as we lie here, I want you guys to focus in on your breathing, and you can bring your hands to the front of your ribs and your stomach and feel your rib cage and your stomach inflate with air as you take a deep breath in. And then as you exhale, feel that breath go. And as always, with all our back pain classes, feeling that change and expansion of your ribs is important to help us activate some of our core muscles, but also to relax some of the deeper muscles around our spine. And sometimes those muscles being tight can be a part of what's giving us back pain. So we'll take one more deep breath here. And then we're going to go into a little stretch to start to open up the front of our hips. So the front of our hips, our hip flexors, tend to get quite tight when we are sitting for a big portion of the day. So what we'll do to set up is bring our left knee in towards our chest and gently hug that knee with both hands. From here, you're going to stretch and walk your right leg out straight. Now, you should feel a stretch across the front of your right hip. There's a chance that your right foot may not even touch the floor, and that's okay. If you want to deepen this stretch, you're going to pull your left knee in a little bit closer towards your chest and maybe bring your right leg closer to the midline of your body. And just lie here, feel the shape of the roller helping to open up the front of your hip. And just breathe. This can also be fairly intense if this is the first movement that you've done today. So be gentle with your body. It doesn't have to feel painful or straining. It should just feel like a gentle stretch. And we'll take one more breath here. And then go ahead and bring your right knee in towards your chest and stretch your left leg out long. So we'll switch to the other side. And often you find one side to be much tighter than the other. So just notice that. You can gently pull the right knee in a little bit closer. If you feel like your roller is going to pop out from underneath you, chances are the roller is too high on your back. So it needs to go down a little lower towards your tailbone. You can always adjust that here now if you feel like you need to. And then walk your left leg a little closer to the midline of your body, so towards the right, to feel a deepening of that stretch. We'll take one more deep breath here. And then bring both knees in towards our chest. And very gently, you can rock your legs side to side. And this can be a nice little massage for some of those muscles at the very base of our spine. And be gentle here. Now we're going to prepare for our first strengthening exercise of the day. So this is for our abdominals. We're going to bring our hands down and hold the roller by our sides. Bring our legs to a tabletop position. Tabletop is when the knees are right over the hips, knees are bent to a 90-degree angle. Now I want you guys to think about your rib cage here. Think of pressing the back of your ribs into the mat. And while keeping that pressure, we're going to start to stretch one leg at a time out away from your body. If this is feeling really easy, you can press the legs down a little bit lower. If this is feeling really challenging, you can push the legs up higher towards the ceiling. So whatever feels like a good challenge for your core, but it doesn't feel stressful or painful. And you want to still think about keeping the front of your rib cage down as though you're imprinting the back of the ribs into the mat. And if you feel like your roller, again, is going to fall away, chances are it's because your tailbone is tipped too far back. Keep your tailbone pushing down into the roller to keep it nice and steady. That's it here, guys. We go for 4, 3, 2, last time, lower one leg down at a time. And then gently lift your hips up. You're going to push the roller away and let your hips lower down to the floor. Very nice. So we just worked on our core, which is, of course, is supporting our spine all day in most activities that we do. We're going to work on our glutes, our hip muscles next, which support our spine when we walk, when we bend over, when we squat, and when we go up and down stairs. So I'm going to put my feet right on the arch, on the top of the foam roller, so that the arch of my foot is draping over the top of the roller. And I want my feet in fairly close towards my bottom, so I can tap my heels with my fingertips if I really reach for them. We're going to do a bridging exercise. And if at any point this feels like too much bridging on the roller, you can just put your feet flat on the floor. So we're going to press our arms down by our side and then lift the hips up to the ceiling. Now, like I said, this should be a glute exercise. So you can check and make sure your glute muscles are active and strong. The roller should stay still as you lift and lower. Now, I get a lot of people here who notice they get cramping in their hamstrings when they do this exercise. You want to imagine that there is a ball between your knees that you're gently hugging in, and that should help you to manage some of the tension in your hamstrings and help you find support from your glute muscles. Good. So see how still you can keep that roller as you lift and lower. And it's not easy. You may feel the work a little bit differently than you do when you practice bridging down on the floor. That's it here, guys. We'll try 4 more. And 3. Last 2. And last time, drop your hips down. And then you can carefully come on up to a seated position. So we're gonna now do some rolling for our upper back. So I'm gonna take the roller and turn it so that I can lay back on the roller and it lines up about at my shoulder blades. So the easiest way to set up is to bend your knees, sit on your bottom, hold the roller with one hand and lay back until it's on your shoulder blades. And then you're gonna hold your head in your hands. Now, quick forewarning, if you have long hair or a hood on, I recommend holding it out of the way because you don't want to roll over it. It doesn't feel great. So once you have yourself set in this position, you're going to walk your feet in a little bit closer and lift your hips up into a hover. And very gently, we're going to roll to the base of your neck down to your rib cage. So you're just rolling the upper part of your back. And I'll talk a little bit more about why we don't go all the way into the low back. But for right now, we're just rolling back and forth. And this gives us a couple benefits here. So one, we are actually mobilizing the joints in your upper back. But two, we're also massaging the muscles and the fascia that support our spine. And the reason we're focusing here in on the upper back is that this is where we tend to have some stiffness that can put more stress on our low back. So all we're doing right now is starting this gentle rolling. And again, if this is the first time you've done this, this can be quite intense. So be gentle. You can always take your hips down, take a rest, but just very gently rolling back and forth. Now you guys can keep going. I'm going to show you something. We can expand the way that we stretch in the roller by adding some sideways movement. So this is our side bending. We're going to bring one elbow towards our hip, and this is the rotation. We're going to actually lift one shoulder off the roller. So we're going to try that down on the roller now. So if we continue to roll, I'm going to start with that side bending. So I'm going to think of pulling my right elbow towards my right hip and continue to roll. And what you'll feel is that that opens up the left side of your spine. And so you can get a little bit deeper into that left side with the side bending. And you can sort of explore how that feels, maybe trying to side bend then over to the other side. So now I'm bringing my left elbow towards my left hip and now opening up the right side. And you might find one is much tighter than the other. If that's the case, you can go back to that side and spend an extra couple of minutes just exploring how that feels. And again, we're going right up to the base of our neck and then down to the bottom part of our rib cage, not any lower. The other piece here we can add in is rotation. So what that will look like is actually twisting towards, I'll go towards my left first. And what you're going to feel when you add this twisting is that you get into your lat muscle. And I think often our lat muscle is thought of as a shoulder muscle. Our lats actually connect to our low back as well. And I think people can be quite surprised at how tight they can be. So finding this release here with this rotation can help to manage some of the stiffness around your spine. We'll rotate now over to the other side. So I'm lifting my left shoulder to get into my right lat. So I'm just very gently twisting towards that right side and exploring how that feels. And you can go fast or slow here. It doesn't, you're sort of in control of your movement patterns while you're on the roller. Work within what feels good for your body. But just know that this can start uncomfortable and it usually gets better as you work into it a little bit. So we're going to take a quick rest and sit our bottom down for a moment. And you want to pause right when the roller is between your shoulder blades. From here, we're actually going to try and create some extension. So I want you to think of pulling the front ribs down, like you're connecting your ribs towards your hips, and then very slowly dropping your chest over the shape of the roller. And notice I say, I'm not dropping my head. I'm not just letting my head hang back. I'm holding my head in my hands. I'm actually thinking of dropping my sternum back over the roller while pulling my front rib cage down. And we're just going in and out of this. You can choose to hold this as a stretch or lift and lower, almost like you're doing a modified crunch, over the roller. And this is to help with extension of the spine. So actually leaning backwards. And as you do this, you might get some cracking and popping in your back. That is not a bad thing, that's normal. It actually may be a good thing in that it indicates that you are getting some movement in your joints. We'll try 2 more like that. Good, guys. And 1 more time here. Good. And then gently come on up to a seated position. Very nice. So what we're going to do next is actually turn our roller lengthwise. And this is where if you have a short roller, you're going to have to modify a little bit. So what I would like to see is that the full length of your spine is on the roller. But if you have a short roller that doesn't accommodate the full length of your spine, I want your head to be on the roller. So I think the easiest way to set up is to sit on the end of the roller, walk your hands back, and lie down on the length of the roller. Now, again, if you have a shorter roller, it's going to be your head maybe to the middle of your rib cage, but then your feet will just need to support the lower half of your body. If you want to grab a couple pillows and put them underneath your hips, you can also do so here. So once you're on the roller, the lengthwise, I want you guys just to notice how your spine feels. So when you can feel your head, your rib cage, and your tailbone, that is sort of aligning your spine in the straightest of patterns. And you may feel like, wow, this feels kind of funny. I don't think my spine is like this all the time. And so it can be kind of a good postural reset or reminder of what really stacking your spine looks like. You may also feel really wobbly here. This can quickly sort of reveal some imbalances in your spine if you tend to sit in one side more than the other. So what we're going to do is test that balance a little bit, but in just a moment, I'd like to show everyone here that you can open up your arms and let your arms rest down by your side to open up your chest a little bit and feel a nice stretch. And you can actually walk your hands up a little bit higher. Some people feel a stretch even with their arms down low by your sides. So just taking a moment here, this can feel pretty good for your spine to have this support and to also get to reset. So what we'll do now is a little stabilization exercise for our core. And if you are on a shorter roller, bear with me. This one's a little tricky for you, but we'll get to one that you can do in just a moment. So you're going to make little tents with your fingertips, just tapping your fingertips to the floor, and walk your feet a little bit closer together. Now, if you feel really wobbly and unstable on the roller already, I want you to work on finding that engagement in your core that makes you more stable on the roller. And if and only if you feel a little bit more stable, you can try marching your legs one at a time. And the reason we practice this is because walking and certainly running create this same alternating leg movement. So this is a good test for us to see how stable is your spine in those types of movements. So as you do this little marching, just notice if you tend to wobble more to one side or the other. Now, if you want to challenge yourself, see if you can lift one of your hands and do the same thing, or maybe try the opposite arm and try that same pattern. And it doesn't have to be fast or big. It can be a pretty small movement. Overall, you want to work towards being able to do this with no hands, which is quite tricky. You can see for me, this right side is much harder and I'm much less stable when I lift the right leg. So go ahead and practice that. This is both a good exercise, but also really good information about which side of your spine might need a little bit more support, a little bit more stability. We'll try 3 more. 2, and last time. Good. Now we're going to try the same thing, but the opposite with our arms. And if you're on that shorter foam roller, this one will work for you. So you're going to reach both arms up to the ceiling and hold. Now, without losing your balance, maybe you just stay here and practice balancing with no hands. You start to drop one arm out to the side and then the other. And this is that same idea. How still can you keep your spine on the roller? But in real life, this looks like maybe something where you were picking up a bag of groceries up on a shelf with one arm. So it's a unilateral movement, and this is testing how strong is your spine, how stable is it when you do something that's asymmetrical with your arms like that. Slowly reaching, pulling the arm in, slow reach out and pull in. Nice work there, guys. 3 more. 2 more. Last time, good. Now, the easiest way to get off the roller is to gracefully roll to your side. Push yourself on up to a seated position. Thankfully, you're not too far from the floor, so that should not be too difficult. So what we're going to get into next is a little bit of soft tissue work for our glutes. Soft tissue work means work that is similar to massage for your muscles, for your fascia, even the tendons and ligaments in the area. So that's what makes up our soft tissue. So I'm going to turn my roller that perpendicular short direction, and then we're going to end up sitting on top of the roller. But I want to show you guys first. We're going to try and do sort of one hip at a time so that we can access the side hip muscles. And so in order to set up like that, I like to reach my hand behind the roller and place my bottom on top of the roller, sort of tipped to the left. So I'm going to do my left hip first. Okay, so I'm going to very gently try and find the muscle. It's uncomfortable if you end up right on the bony part of your hip. You want to find the muscle and then very gently start to roll front to back using your feet to push. Okay, we focus on these glute muscles, these side hip muscles, because all the nerve roots that supply our legs, they come out of our back and then they run right through our glutes. So when these muscles are tight, they may restrict the mobility of the nerves in our legs. So it can be helpful to relieve some of that nerve pain, especially if you have symptoms like sciatica. It can be helpful to do soft tissue mobilization like this. Now you can really twist to the side to get into the side hip muscles. You can also sort of orient yourself to face the ceiling to get more into the center of the glute. And I think you'll feel it depends on the person where those really tight spots are. But when you find one of those zones, spend a little bit of time working that out. Now for me, this is quite intense. This is enough. But if you feel like you need more pressure, I could cross my right ankle on top of my left thigh. And what that does is it just gives me more body weight through that side of my hip. So go ahead and give that a shot if that feels comfortable for you. And for many of us like me, this is plenty to have both feet down on the ground. So we'll just spend another moment here. Maybe you can change the angle a little bit. And then we're going to switch up and over to the other side. So I'm going to place my other hand down. I'll roll to face more towards my right hip and play around. And I think you'll find that you have a fairly significant difference from side to side. I know for me on my right hip, I like to be oriented more towards the ceiling rather than all the way over to the side, the way that my left hip felt. So you can test that out. Again, if you want to add that increase in pressure, you cross your left ankle on top of your right thigh, and you can see how that feels. It should not be super comfortable, but it should not be sharp shooting pain. If you're getting sharp shooting pain down your leg, back off a little bit. You're putting maybe a little too much pressure through an area where the nerve is already sensitive. Now, I always like to remind people that when you do this type of soft tissue work, it should feel better afterward, but you may actually be a little bit sore the next day. And it's not sore in the same way that you have back pain like you may have coming into this class, but it might be soreness like you did a hard workout and your muscles are fatigued the next day. That's totally normal. I always recommend that you drink a little bit of extra water tonight and tomorrow to help your body flush some of the acid that builds up and that you have released by doing these techniques. Good. We'll try just another breath here. And then very gently lower down. We're going to do one more soft tissue technique, which is for our calves. And again, our calves have a lot of nerves connected to our backs. Our calves are also our shock absorbers for our spine. So if you were in my class a couple weeks ago, we practiced strengthening our calves to help with shock absorption during walking and running. So I always like to address them with soft tissue techniques as well. So what we'll do is place the roller underneath our calves, and we're going to start doing both of them together. I'll show you how to change that in a second, but you'll reach your hands about 6 inches behind your bottom and lift your hips up, and you're going to roll your hips front to back, pushing with your arms. Now this can be kind of tiring for your arms. It can be a little bit of core work too, so you may need to set your bottom down and take a rest. Now, if you want more pressure in one of your calves, you're going to stack one leg on top of the other. So in this case, my right leg is stacked on top of my left. I'm only really feeling the work in my left calf, and I can do the same by changing over to the right side. Now you can also play around with rotating a little bit. So I can turn my feet to face one direction, let's say both of my feet to the left. I'll get the inside of my right calf and the outside of my left, and then I can change and turn them to face the other direction. And again, each body is different. You're just exploring what feels like the tight zones for you. Where do you need to work? Maybe you need to even go a little lower down towards your Achilles. You can see how that feels versus coming up a little bit higher, more towards the top of your calf and your knee. And just explore that, be gentle, shouldn't be painful. If your wrists really, really bother you, you can also do this on your forearms. It's a lot of work for your shoulders, but you can try that here. So that's always an option. And we'll give this just another moment or two, side to side. Very nice here, guys. Good. Okay, and then we're gonna set our rollers off to the side. So the last thing I like to do after all that movement is just to rinse out our spines a little bit with some freeing, open up spine motion. So sitting down on your mat, open your arms wide out to the side, make the widest wingspan you could possibly imagine, and you can sit in any position that's comfortable for you. And we're gonna gently just side bend the spine up and over. So just a little more fluid movement here, kind of releasing, feeling nice and natural and free with the way our spine moves, the way our body moves. And it's okay if you have a difference from side to side. Let this be comfortable. It should just be gentle. Good. Allow your breath to be natural here. And you can keep a soft bend in your elbows if you have any shoulder sensitivities. We'll do 3 more and 2 more. And last time, take a rest. Very nice. Awesome work there, guys. So what I hope you take from class today is a couple of techniques of how you can use your foam roller, maybe in ways that you haven't thought of before, but to certainly complement your lower back. And I had a couple good questions in my last class about how frequently to do this stuff. I like to make a differentiation between the soft tissue techniques, so the type where we're really rolling the muscles. Those techniques you want to do maybe 2 or 3 days a week. Because they do create very, very micro damage in your tissue, doing that every single day might be a little too aggressive. So 2 to 3 days a week. But the use of the foam roller for our stretching techniques, where we had the foam roller under our hips or we had the roller along the length of our spine, you could do those stretches certainly every day. You could even do them a couple times a day. So keep those ones in mind as little bits and pieces that you could integrate throughout your workday to help keep your back flexible and to keep your back strong. So with that being said, I would love to answer any questions that you guys have about this class or about back pain. Because we are a nice small 5-star class, if you want to unmute yourself, you can do so. You're also welcome to write into the chat for any questions that you have. And I ask that you guys also, if you have a moment to stick around to leave feedback, I would love to hear from you guys what you thought about this class. I will show you how to do so in a moment, but I want to make sure I can answer your questions first. So I have a question. What are the exercises related to soft tissue that you should only do 2 to 3 times a week? The one where we were rolling your glutes and the one where you're rolling your calves. So the ones that are focused on sort of getting rid of the knots in your muscles, those are the ones you want to do more like 2 or 3 times a week. Good question, though. Any other questions? Mark, go ahead.
Just that foam you have, is this like a standard density, or there's different like stiffer and softer ones, or?
There are different densities. So the one that I have is sort of a high density. It's sort of a traditional standard roller. They do make rollers that are softer densities as well. And you can do all of these exercises with the softer density. Just know that some of them will not be as intense, the ones especially where you're trying to roll out the knots in your muscles. But for some people who, just have some more sensitivity to how their skin feels, how their muscles feel, they are much more comfortable with the softer roller. That's fine.
Okay. Was it empty like this, or yours is full?
Mine is not, but it's probably about the same density as the empty ones. Those ones work fine. I've also had a couple of questions about whether the texture matters or not. The texture will make it a little bit more intense for the soft tissue techniques when you're rolling out the knots in your muscles. It's not a bad thing. It just makes it a little bit more intense, but you can certainly use those for all the stretches we did today.
Okay.
I have another question here. How do you keep the roller steady? It felt like mine slipped a lot. That's also something I hear. There's a couple factors. One is like the slipperiness of your floor and your mat. So hardwood floors don't tend to work well. I find more like a yoga mat that has a little grip, or you can even put one of those sticky carpet mats down. Those work well. But secondly, your clothing, if you have really slippery clothing, that can make a difference. The last thing though is placement. So like I said, sometimes if you put the roller too high on your back, it can, when you tip your spine, it'll flip out from underneath you. So you may need to just sort of adjust the roller to be a little lower or higher depending on the exercise. So let's see. Let's see. My seat, I'm not sure I'm reading this question correctly. I'm seeing that I'm slouching all day and my low back and the mid back is always straight. How can I improve this? If I'm interpreting this question correctly, I think working on your seated posture, I do talk a lot about sort of ergonomic setup in a couple of my previous classes. So you may want to go back and check in with those. But improving your upper back flexibility can help you to find better alignment in sitting. And we did a lot today to improve the upper back flexibility. So let's see, I'm going to answer just a couple more before I go show you guys how to use the feedback app. What causes mid or upper back pain when standing for a long time? That's a good question. I think it's very hard to say without really doing a full evaluation on somebody's spine, but I often see that mid-back, sort of around the shoulder blade pain, is usually referred from the neck. So I often would screen the neck, but notice if maybe when you're standing, you're also looking down on your phone, that's a common one, or maybe carrying a really heavy backpack or a bag. I would try and check in with your posture. If it's standing at your desk and your computer screen is too low, that's another cause. You may need to bring your screen up a little bit higher.